Hello people, let us look at anti-cancer drugs chapter, okay, in pharmacology. So here, anti-cancer drugs or chemotherapy drugs, chemotherapy can also be antibiotics, okay. So chemotherapy can also be anti-cancer drugs. So you should know, here we are talking about anti-cancer drugs. So hope it is clear for you. Chemotherapy can mean antimicrobial or anti-cancer, both of them. Here we are dealing with anti-cancer drugs, okay, right? So this, we assume that you know that cancerous cells are neoplastic cells. They are uncontrolled, purposeless, without stimulus. They keep proliferating autonomically, okay? So many definitions, you can go through that. Now looking at the classification, guys. Classification, 4 such charts you will see. Okay, the first two refer to cytotoxic drugs. So this is cytotoxic drugs. Cytotoxic drugs. Then you have targeted drugs for anti-cancer therapy. Then you have hormonal drugs. 4 things. You have seen 4 things now. Just try to recollect. Cytotoxic drugs. Okay. Then you have targeted drugs. Then you have hormonal drugs. Fine. So you should know the important ones in these. So in this, let us see cytotoxic drugs, what and all are important. See, in cytotoxic drugs, mainly alkylating agents are important. They have asked these in the exam. Alkylating agents, under which you have a lot of them. We'll come to that. Then you have platinum coordination complexes. Cisplatin is a good example. Platinum, imagine, platinum complex, okay. Then anti-metabolites, you have methotrexate, that's a folate antagonist. Methotrexate is what is shown here in the diagram. So methotrexate is important for exam also. Then you have purine antagonist like azathioprine. This also has been asked in the exam. Anything marked in dark green is actually asked in exam. Then you have pyrimidine antagonist like fluorouracil. It is antagonist, okay, pyrimidine antagonist. All these, if you can remember in this chart, what and all you can remember. Oops. In this chart, you can try to remember under alkylating agents, you can remember cyclophosphamide. This is actually a prodrug which gets converted into a active form in the liver. So you should know this cyclophosphamide, very important for exam. Cyclophosphamide, okay. Similarly, you have I-phosphamide, cyclophosphamide and I-phosphamide. If you want, you can remember these two names. Then under platinum coordination complexes, you can try to remember cisplatin. Then here you have to remember methotrexate. That is a folate antagonist. No excuse to not knowing methotrexate. It's a very commonly used anti-cancer drug. Then azathioprine, and if you want, you can remember the others. No force there. Okay. Then let us move on to the second chart. Cytotoxic drugs, part 2. Here you have microtubule damaging agents, topoisomerase 1 inhibitor, topoisomerase 2 inhibitor, antibiotics are also there, and miscellaneous drugs. Like cytotoxic means what? They are harmful to the cells. So in that you have urea, arsenic, L-asparaginase. L-asparaginase has been asked in your exam, so you should know that. Vinca alkaloids and taxanes. These are microtubule damaging agents. These two are also important for the exam. And these actually, both of these are natural products. Like this Vinca alkaloids, they come from the periwinkle plant. Okay, and taxanes come from this yew tree, Y-E-W tree. Okay. So in this chart, what and all you can try to remember. Guys, you can try to remember Vinca alkaloids, taxanes and L-asparaginase. Okay. Is it tough? Feeling difficult? Hello people. We are looking at cytotoxic drugs under anti-cancer drugs. There we have seen alkylating agents like cyclophosphamide, I-phosphamide. Then we saw cisplatin, methotrexate. What else did we see? Alkylating agents, cyclophosphamide, cisplatin, we saw methotrexate, we saw, then we have to know this azathioprine. Okay, that also we have to know. Then in the second chart, we have seen vinca alkaloids and taxanes and also L-asparaginase, correct? L-asparaginase, right? So this much we have seen so far. Let's move on to the third diagram. However, this is for targeted drugs. In targeted drugs, just look at the headings. You can target the angiogenesis, so angiogenesis inhibitors, CD20 inhibitors, proteasome inhibitor, all are inhibitors only. BCR-ABL tyrosine kinase inhibitors, EGFHER receptor inhibitors, angiogenesis inhibitors. Do you know what these words are? So that is nothing but angiogenesis, nothing but the new blood vessels, okay? The formation of those will be inhibited. Epidermal growth factor receptor inhibitors, then BCR-ABL tyrosine kinase inhibitors, and CD20 inhibitor, proteasome inhibitors, okay? So we have finished the targeted drugs, guys. Now let's move on to hormonal drugs. Hormonal drugs, sometimes, you know what happens, because of excess estrogen, there can be endometrial carcinoma. Such things to prevent, you can give an anti-estrogen, right? So example for those type of drugs, you know, like you can give many things. Like look at this, SER downregulator. So this is a selective estrogen receptor downregulator. Fulvestrant, okay. So estrogen receptor is downregulated. Here you can have a modulator this is. It could either be positive or negative, like tamoxifen, selective estrogen receptor modulators these are. You can give progesterone, okay. You can give anti-androgen, gonadotropin releasing hormone analogs, okay. Then so many things like glucocorticoids also can be given as a hormonal therapy because this is an immunosuppressant, prednisolone, okay. So hormonal therapy. Estrogen itself can be given if you probably need estrogen in the person and the lack of estrogen is creating problem, right? So there you can give ethinyl estradiol, fine. So here basically based on the situation they will give the opposite treatment. You understood? Opposite requirement, whatever is there, they will give that. Okay, wake up guys. We have finished the 4 charts also of anti-cancer drugs. First we saw cytotoxic, then targeted, then now we have finished hormonal. I think for now that much is enough. Let's just look again, anti-cancer drugs. So we have looked at high-level classification, cytotoxic drugs, alkylating agents like cyclophosphamide, then you should know cisplatin, methotrexate you should know, azathioprine, moving on, you should know L-asparaginase, you should know vinca alkaloids and taxanes which are microtubule damaging agents, you should know these guys, they have been asked in the exam. Then moving on, targeted, right? Targeted drugs, you can think about angiogenesis inhibitors, epidermal growth factor inhibitors, CD20 inhibitors, etc. Then moving on, hormonal drugs, you can give estrogen or you can give estrogen receptor downregulators, you can give selective estrogen receptor modulators, you can give glucocorticoids, anti-androgens, progesterone, etc. Okay, very good. In the next video, we will continue with anti-cancer drugs. There is a lot to cover. So if you come back, we can look at all this. Methotrexate, azathioprine, vinca alkaloids, L-asparaginase, how to remove toxicity, how to reduce the toxicity of anti-cancer drugs. Then natural products, we already told you, vinca alkaloids, taxane. And this is how cancer therapy shows that the population of cancer cell decreases over time. Okay. So some chart here to show how the cancer treatment helps. Okay. Basically here the focus is anti-cancer drugs. So as such we are looking only at drugs. But as anti-cancer therapy can have a lot of other things also like radiation therapy. Right. So there are a lot of other things. Here we are covering only drugs. See you Come for the next video if you need to know more. Bye bye.